Question. A 35-year-old construction worker presents to the clinic with progressive difficulty hearing over the past several years. He reports that he has trouble understanding conversations, especially in noisy environments. He has been working with jackhammers and heavy machinery for over 10 years without consistent use of hearing protection. On physical examination, Weber test lateralizes to the right, air conduction, bone conduction bilaterally. Which of the following best describes the most likely cause of this patient's hearing loss? A. Damage to the cochlear nerve. B. Dysfunction of the ossicular chain. C. Loss of stereociliated hair cells in the organ of Corti. D. Rupture of the tympanic membrane. E. Accumulation of endolymph in the inner ear. Loss of stereociliated hair cells in the organ of Corti. Explanation. This patient has noise-induced sensorineural hearing loss, NIHL, due to chronic exposure to loud noise from jackhammers and heavy machinery. Pathophysiology. Prolonged exposure to loud noise, 85D BOD, causes irreversible damage to the stereociliated hair cells in the organ of Corti. High-frequency sounds are lost first as the base of the cochlea, near the oval and round windows, is affected first. Low-frequency sounds are detected at the apex of the cochlea and are lost later in severe cases. Weber and Rinne test interpretation. Weber test lateralizes to the right, suggests sensorineural hearing loss in the left ear or conductive hearing loss in the right ear. Rinne test, AC-BC bilaterally, confirms sensorineural hearing loss since air conduction should be greater than bone conduction in normal and sensorineural loss. Common causes of noise-induced hearing loss. Occupational exposure, e.g. construction, military, factory work, musicians. Sudden loud explosion, e.g. gunfire, fireworks. Frequent headphone use at high volumes. Complications, permanent hearing loss, tinnitus, ringing in the ears. Increased risk with aging, presbycusis may worsen symptoms. Prevention and management, hearing protection, earplugs, earmuffs. Avoid prolonged exposure to loud noise, hearing aids if needed. Why not the other options? Option, why incorrect? A. Damage to cochlear nerve would cause sudden, severe hearing loss and could be associated with vestibular symptoms, e.g. dizziness, vertigo. B. Dysfunction of the ossicular chain seen in conductive hearing loss, e.g. otosclerosis, which would cause bone conduction, air conduction in Rinne test. D. Rupture of the tympanic membrane, typically caused by acute trauma or infection, presents with pain, hearing loss, and possible otorrhea. E. Accumulation of endolymph, seen in Meniere disease, which presents with episodic vertigo, tinnitus, and low-frequency hearing loss. Take-home point. Noise-induced hearing loss is caused by irreversible damage to the stereociliated cells of the organ of Corti, leading to sensorineural hearing loss that affects high-frequency sounds first. Prevention with hearing protection is key. Would you like a question on Meniere disease or otosclerosis next?